Okay, we are back again. We have Ashley Langford, Director of Clinical Excellence at CORA. We have Alex Guanco, Director of Clinical Education at CORA. I'm Adam, the marketing guy at CORA, and we are talking in this clinical conversation about lower back pain again, or back pain, and specifically what students are learning in school these days. Alex does a lot of work with schools, especially local to the Miami area, and what happens when they get into the clinic and they start treating patients, and then what? What's next? So maybe let's start with what's happening at the academic level.
So it's actually kind of interesting. There's so much to know about. There's so much to learn in a very short period of time for PT school, right? Like you have to learn every potential pathology diagnosis that you can see in a clinic, and you have 2 to 3 years to do it. So when we say what we're learning, it's pretty general. We will learn the top 5 diagnoses that we might see in the clinic, and that's kind of it. And then depending on the school that you go to, everyone kind of has like their thing, their shtick, right? So if you go to one school, you may learn this type of manual therapy, whereas if you go to another school, you may learn a completely different theory altogether. They're not wrong. It's just that you're learning one part of PT versus maybe 10 parts of PT. So everyone's teaching what their professor is comfortable with, what their professor is an expert in, and that might not be everything, right? It may just be what they're comfortable with. Even for myself, some of the things that I've been taught in my career, I'm not comfortable with that. Like whether it's how I put my body, how I have to hold the patient, like some of those things just don't work for me. So I've had to learn adaptations for myself, and it's way easier to learn from somebody that's already learned it and been there and done that versus trying to figure it out on your own. So a lot of my education for PT and treating low backs came after I graduated.
Yeah, so that's interesting. You said that. I didn't think about that. We met at CSM, the 3 of us, and let's just say we are different heights. And I imagine the way you approach your patients, the way you approach things is very different from the way that Ashley approaches them, because he just has longer levers and stuff.
Yeah, I'm 5 feet tall and I have short arms. So anybody with any kind of like barrel chest or mass, it's very hard for me to put my whole body around them. So I've had to learn adaptations. So typically when I teach, whether it's at the academic level or even clinicians or even my residents, I definitely try to give options. Like this is how I'm taught. This is how you may have taught it or have been taught it, and this is my personal preference. And sometimes I say, oh, I learned this from Ashley, so let me show you how Ashley does it. Which one do you feel most comfortable doing? We're all getting the same effect, but the one you feel most comfortable doing is going to be the most effective for your patient.
Yeah. Going back to like the schools too, I think, even with the best education, the most current research, at the end of the day, we're treating human beings, and every single person that walks through the door, regardless of how structured your training was, is gonna throw you because, you got to, what's their background? What are they presenting? What are they looking for out of therapy? It all changes, and I think that's the beauty of what we do. That's what makes it fun. But it's hard to take this mass of information and research, and then without necessarily, maybe a few decades of experience of seeing how research has trended and changed. I think there's value in understanding where was the research 15 years ago or 20 years ago, and where do we think it might be in 15 more. There, it's we're seeing changes happen all the time now. So 100%, what's your experience in the clinic during your clinical rotations? Where do you take your first job? I would tell anyone, regardless of where they go to school, take a job where you can continue to challenge your understanding, your education, and mentorship.
I think one of the other aspects that's I think it's a shortcoming, again, because of time. We don't really get a lot of psychology. We have classes in PT school on communication, but there's a psychology aspect to it. right? Like, again, we're dealing with humans. So although we're taught the mechanics, we're taught how to make something that's not moving move, or something that's moving too much, how to make it more stable potentially. But how do you deal with that when it's a mom that's been carrying her kid for the last 3 years on one hip and is now like thrown herself completely off? Or a grandma that is stressed out because she's living at home with her son and doesn't want to be there. Those are stressful situations that will create different ways for us to approach the patient. And truthfully, from a school side, we're just not taught enough about the psychology behind things. So although we are taught the majority of what we really need to know as far as pathology, once we get into the clinic, it's not so perfect.
Mhm. Yeah. It's interesting, Adam, because there's a lot of hybrid PT programs developing now too, where you go to PT school and most of it is from home and you're watching over video. And so they have designated times that you would show up to the clinic. So you might only meet your classmates, a couple times throughout school, is my understanding. So that'll be interesting to see how that develops and where we go with that.
What we're
And okay,
seeing is that it's harder to communicate with your patients because you're not used to having to communicate with all different walks of life, ages, cultures, as often as you would have if you were in a class with 60 people all day, every day, or 90 people.
when does the role, so you, both of you teach some kind of back course, right? Through the Institute.
Mhm.
When does the role of continuing education kind of trigger? What, I mean, is it something that you should pursue directly out of school? You get your job, you're looking to kind of keep learning, so you're going to jump into that, or are you going to gather some experience first, treat some patients, and then you're going to say, okay, I realize my gaps maybe. These are like, are all the courses different? Are they all the same? I know that, I mean, the back is the back. I think there's evolution, things are changing, research is changing, approaches are changing. But again, where does that fit in? When does continuing education fit into the to the path?
Alex and I have had many long discussions about this, and one of the things that comes to mind is we've talked about some people that are narrow-minded like me come out and we're laser focused on what we want. I came out of school and for some idiotic reason I wanted to be good with my hands, manipulate, I wanted to learn all that. That was my laser focused pathway. But there are others that are more what did we call it, Alex? Like more like a spotlight, that want to
Mhm.
take in things that to fill areas for comfort or whatever the reasons. And any path is okay as long as you buy into being a lifelong learner. There's a lot of different options to do it, but coming out of school and deciding that I've got my doctorate, I know what I'm doing, and shutting off the door to continuing to learn, I think is the biggest mistake.
I
Alex, what
think
do you?
I have a couple opinions. I think first of all, I think it's important to know that most of the time school isn't quite caught up to the research. It's just not like it, there's a few year transition period where school will then start teaching, right? So with the research that's coming out, your continuing ed classes are going to be more up to date. They have to be up to date for us to be even credentialed to teach them, versus school can stay behind a little bit because they're teaching theory versus what's happening now. I think that you come out of school and you should have a couple, like 3 months or 4 months of experience, because then you're really going to find out what you don't know, right? But you also get the chance to see, like, all right, I'm good at this, I'm not so good at this, this is what my clinic sees a lot of, and I didn't get any of that in school, so let me do a continuing ed on that. And then I think after those first 4 months you can start to say, all right, well, this is where I'm interested. I wanted to be ortho, so I just wanted to know everything that had to do with orthopedics. um, and I liked doing my hands too, but I wanted to know other things as well. Ashley wanted to be really good with his hands. So I think within those first few months, you have an idea of what you really like. Um, and I think that you continue learning on the things that you really like, and then occasionally throw in something that you really don't like. I really don't like vestibular. I have taken many continuing ed courses on vestibular, and it's just not my thing. It's just not. But because I know I'm not very good at it and I see it all the time, I have to have some kind of baseline. I refuse to be a bad therapist. And I think that's part of it. You need to refuse to be a bad therapist.
I think if you go back and listen to Ashley and I's last 3 episodes with Mark and Caitlin, I think you will be a much better vestibular therapist. That's just
That's
me.
my homework.
That's me. The non-clinical contributor to this conversation. That's just me.
That's my homework.
Okay. All right. Well, okay. I think that's anything else to add on. I mean, this is just kind of a quick conversation about the education surrounding back pain, lower back pain, treating back pain. Patients should know that they're in good care, whether they're seeing somebody out of school or somebody that's been out of school for a long time. Clinicians work together, right? And it's a benefit to the PT, I think, in the career, right? Just to continue to keep learning, be a lifelong learner, as Ashley said.
I will challenge both new clinicians and old clinicians, right? New clinicians, there's always something to learn from clinicians that have been out. Don't be discouraged if it wasn't exactly what you learned in school, because they may have gone to a different school. And older clinicians, don't be afraid to learn from newer clinicians, because they may have also learned something that you didn't learn in your program. So I think if we are open-minded enough to learn from each other, and to continue and to challenge ourselves to continue learning, our profession will do great things.
Hard not to end on that note, Ashley, but if you have anything else to say, this is the time.
Yeah, I will say from a selfish perspective too, as a clinician, it's like being a musician, right? If you decide you want to play piano and you put 2 years into it or 20 years, the more you put into it, the more it pays back. And the selfish component is continue to challenge yourself to learn more, and through various, schools, and you'll find that work becomes more and more enjoyable. You're going to identify things. You're going to be more confident with your processes and where you go with treating the patient. And it seriously just, it makes the day more enjoyable and easier. It's empowerment. So day after it.
Okay, good stuff. Thank you, Ashley. Thank you, Alex. That concludes the 3-part segment on back pain. And until our next conversation together, thank you, and we'll see you soon.